August 15th, August 15th, 2025. Good afternoon, Secular Fam. I hope that you are all doing well this week, and hopefully you live somewhere where you got some nice monsoon rains. I woke up at 10:30 last night and then again at like 2 o'clock in the morning, and it was still raining. Lovely. We need this in Arizona. So wherever you're joining us from today, please feel free to put your name in the chat and change the blue button from hosts and panelists to everyone. There are so many nonviolent protests that are happening tomorrow. So if you are attending some kind of nonviolent, non-compliant protest or any other kind of civic action, drop it in the chat and let us know where you'll be to stand up against fascism. I do want to give a shout out to Farrell. She comes to our Friday guest speaker series almost every single Friday, and she reached out to the schools in her community to find out what their plan is if ICE comes on campus. So shout out to Farrell. Thank you for being, I guess, an upstander, like being proactive. I also encourage all of you to reach out to local businesses. I want everybody to follow Farrell's lead and do the same in your community. And then maybe even encourage all of your local businesses to put signs up and have plans in place if ICE does come onto their properties. I'm hoping that Lindsay and maybe Ian are dropping some links in the chat, but there are opportunities like crazy to find comfortable community all over Arizona. Next week, we're going to be speaking with Carrie Sampson, PhD, as she discusses her book, Navigating School Board Politics, a Framework for Advancing Equity. So you won't want to miss that. But for today, I am so excited. And it might be a Rage Friday, it might be a Hope Friday. But Dr. Richard Carpiano is professor of public policy and sociology at the University of California, Riverside, where he is also a faculty affiliate of the Center for Healthy Communities. He is co-editor with Brian Kelly of Purdue University of the Journal of Health and Social Behavior. Dr. Carpiano is a medical sociologist and population health scientist who studies how social factors such as socioeconomic status, race, ethnicity, social connections, and community conditions contribute to the physical and mental health of adults and children. And as I read this too, it just makes me think so much of how the other side goes against the idea of whole child education and what that really means. Because our kids come to school with so much more than just what's in their backpacks. So I'm really excited about this discussion. His research also focuses on an extensive range of health issues in populations spanning the life course and US and international contexts. Some of his past projects examine social determinants of child undernutrition in India, childhood asthma, early child development, HPV vaccination, smoking and alcohol use among adults, body mass index among Danish women, substance use and sexual risk among gay men, suicide ideation among Canadian immigrants, and life expectancy/mortality risk among high status individuals. The most recent arm of Dr. Carpiano's research program investigates social, behavioral, and attitudinal factors underlying child vaccination uptake, hesitancy, and coverage, as well as public support for vaccination policies in the US, Canada, and several other countries. His solo and co-authored publications have appeared in forums such as the American Journal of Public Health, American Sociological Review, Health and Place, Journal of Health and Social Behavior, Social Science and Medicine, and Sociology of Health and Fitness. That is a lot, and it's fantastic. And I think that you and I could probably just sit and, enjoy a cup of coffee for hours long. So if there's anything in your extensive bio that I've missed, Dr. Carpiano, please fill in the gaps.
Yes, thank you. Thank you very much for that. I'm already embarrassed. I believe I might have sent you a little bit of a dated bio. thinking with the same file name. But no, all of that is true, albeit a couple years ago. So just as an update of that, the majority for just so everybody kind of knows my background too. So I'm exclusively a professor of public policy these days, and I do a lot of work very much related to vaccine acceptance and policy, particularly in the United States, but again the international sort of work. And more recently with COVID, I've moved a lot more into also doing work on pandemic preparedness and policies around that, including equitable access and a whole range of different factors with that, and serve on a variety of commissions and policy work with that. But I don't want to waste all my time just talking about myself. Anyway, I just want to say thank you so much for the invitation. I'm really excited to be here, and I look forward to chatting with you. Should I just open my
Yeah, you
uh
can go ahead and share
okay,
your screen with us, and
great,
I'll kind of
excellent.
probably turn my camera off so I'm not a distraction and we're all just focused on you, okay?
Okay, great.
All right,
Uh,
thank you.
my okay. So I have a
Wait,
little
real
bit.
real quick, Dr. Carpiano, I'm not
Yes.
seeing your
Oh, you know what? Because I'm not sure. I didn't share my screen. Uh-oh. Okay.
I'm glad I'm not the only one.
Boy, now this is two things working against me today. Oh my gosh. Good thing it's a Friday, right? All right. Where are we here?
There we go. Well, hold on, it's gonna get there. There we go. And then if you want to
Okay.
make it bigger, if you're able to make it bigger, I'm sure that our audience would really
Yes,
appreciate
let's do
that.
that.
Yeah.
I've got one of those big screens that I
Awesome.
think
Perfect.
might be easier
Thank
when you
you.
share it too. So, hello everybody, and thank you very much for the invitation. I'm really flattered to be asked to chat with you today. While I am very excited to talk with you, especially answer your questions about things that I might be working on, and I could maybe give you some insights on. I have to admit that I think the topic that I've been asked to do today is a little bit unenviable, in the sense of that there has just been so much, and even up until this probably, I guess I could say about 20 minutes ago, I was still reading some related sorts of matters. Unfortunately, a lot of it not good, but nevertheless, such is the nature of the topic. So what I'm going to do is I'm going to focus, because I do a lot of stuff around vaccine uptake, anti-vaccine activism, and trying to understand that, misinformation around vaccines, but also I do some other work around fluoride hesitancy, for example, with some of my dental colleagues. A lot of my work, a lot of what I'm going to talk about today comes out of kind of the stream of the anti-vaccine world. So I'm going to offer some as Lindsay has asked me to do, some observations on just sort of the impacts of misinformation to public health, particularly recently. But I want to add some historical context to that, to really sort of understand how really the past has been kind of prologue to so a lot of the problems that we're seeing here today, nowadays, and how some of it actually is not all that new, but really kind of just rehashed. And then I'm going to talk at the end about some more concrete ways to address such impacts. Some that might be a little vague, but still at least offer a roadmap for maybe how we need to be acting, particularly in 2025, given this very unique kind of nature of things. And then, of course, get to your questions. Here, is this not? Oh, there we go. Okay. Oh, you know what? Are we? Oh, there we go. If I shrink this just a little bit, is that still visible?
It is for me, and I know that sometimes with Zoom, it's a yeah, like that's good. We
Okay,
don't
we're
need to
good.
see
Okay.
you. Yeah, yeah, you're good. You're good. Thank
No
you.
worries. Okay, great. Yeah, excellent. First thing, I'm going to break this kind of up into sort of historical kind of parts. And I think to kind of understand kind of where we're at right now in terms of thinking about kind of the current role of misinformation, types of policies that we're seeing coming down the pipe. It's important to kind of understand anti-vaccine activism pre-pandemic, particularly given the fact that so much of that rhetoric and that kind of logic and motivation and a major figure of the anti-vaccine movement is now things that we see in the federal government in relation to different sorts of policies that have been undertaken. And so when I'm talking about the modern anti-vaccine movement here, I'm talking really about roughly around 2000, 1998 or so onward. After the autism vaccine concerns were starting to emerge with the very infamous Andrew Wakefield study that was later retracted, that was published in the early 2000s. And when we start to get into kind of the late aughts, 20 teens, we start to see the anti-vaccine movement really starting to make some major gains in visibility. Whereas we might have thought about it beforehand, it's maybe a little bit kind of crunchy, a little kind of granola. And kind of, and really kind of fringe, it was getting much more sort of traction in terms of its messaging. So we saw very much an evolving rhetoric and messaging, whereas before they were kind of, they would often be, get beaten up quite badly when trying to debate science. So in this case, now by this point, we start to see an increasing focus on philosophical issues like health and medical freedom and parental rights, which are things that are a lot harder, they're more debatable. And they were a lot harder to just kind of say, make a scientific claim and whether, and that could be debunked by good evidence that existed. Also, we saw an increasing alignment with right-wing political identity. We start to see bills related to vaccines becoming more partisan, particularly anti-vaccine ones. And with that, the movement was able to access more money, more political clout, broader audiences. Whoops. Oh, there we go. Okay, so then the pandemic comes along, and really that blew everything kind of open in many respects. We see an expanded scope and discourse because, remember at the early start of the pandemic, there were no vaccines. I even naively thought to myself that if I had to put some rosy lenses on, that there was going to be that this might be the chance that America would kind of see that anti-vaccine rhetoric was really bad and how harmful that was. And that it was going to suck the wind out of the anti-vaccine movement. How wrong I was. If you're laughing right now, that's totally fine. Have at it. I kind of deserve it. So we do see this expanded sort of scope and discourse that was really originally very heavily centered on child age kind of vaccines, things you would need to go to school, to now extending to vaccines that all the population, including adults, would be taking, as well as to more broader COVID-19 and even broader public health issues related to sheltering in place and other sorts of activities that public health carries out as being a government sort of function. We saw new influential actors that would be part of this or can kind of contribute to that dialogue. Media influencers, very contrarian sorts of scientists and clinicians who are becoming prominent, making TV appearances, writing op-eds in leading newspapers. And even started an increase in sort of elected official allies, governors, for example, or state senators and the like. And then also we would see expanded strategies and tactics, including some rehashing of some old and long debunked claims too. So that it would be, some of those would be things related to influencing public opinion. And some of that even would be targeting even particular sorts of groups, historically underserved groups, marginalized groups, vulnerable populations. For example, we would see activism that was becoming at multiple levels, not just at state houses, but at local level, at schools. You have a talk coming up about school activities. We've definitely seen a lot more kind of movement around that and keeping things sort of more local. And then also just the silencing and threatening of experts too. So much more of a sort of you could say sort of a more violent sort of element to it, or a more concerning one of harassment, intimidation of public health officials, scientists, people in the medical community, for example. And the impacts of that we see were concerning and started to become very partisan. We see here, this is data of the percent of U.S. adults over 3 time periods, 2 before COVID, 1 sort of towards the end of the pandemic, who say the following about childhood vaccines for measles, mumps, and rubella. And we see here that suddenly we start to see that an appreciation or a preference rather that children, the less parents should be able to decide whether not to vaccinate their children, even if that's going to create health risks for others. We see much more, we see an increase in support for that. And that particularly seems to be being carried by people who identify as being Republican or leaning Republican. So again, this, sort of now partisanship, political party starts to become a very prominent sort of predictor of a lot of anti-vaccine sort of sentiment and vaccine hesitancy. We see this also not just in terms of attitudes, but also how people behave. So in this case, parents getting exemptions for their children out of schools. And we see a rise in the number of states with increasing exemption rates. Across both sort of the beginning of COVID, but then much more sort of current. And Arizona would be located in, unfortunately, in that 17 group. It has greater than or equal to 5% of exemption rates of all children in the state. And that's not, think about that, that's going to be clustered in particular areas in kindergartens and things. So infectious diseases are all local. In the sense, like politics, they say, in the sense of, so that's concerning if you're going to have, sort of pooling and what that might mean for potential outbreaks. But it's much more, I want to emphasize, I'm focused here on vaccine stuff, but this is really much more than just a vaccine issue. It's really much more of an indicator of broader trends about how public was seeing things about science, how they were thinking about medicine, government, indicative of kind of a very polarized public discourse that we were having, that we still have. It's very partisan. This kind of neo-libertarian sort of groundswell that we were kind of seeing related to sort of personal freedoms and rights, and parental rights and medical freedom and self-autonomy, not having to be told to do things like wearing masks, misinformation, disinformation, conspiracy theories, all sorts of different things. Tom Nichols writes about the death of expertise and how we start to see experts really becoming challenged and the idea of that. The wellness industry is being also very much a competitor to traditional sort of medical care and medical science. And being quite a lucrative industry, and then other challenges to other public health successes. For example, fluoridation of water, which we see as an incredible public health success. So this presents, in many respects, all this all together, and how we see this not just around vaccines, but then around other sorts of health information. Really, health misinformation in of itself is really is just a massive 21st century challenge for public health. So now part three. So historically, we get to sort of the current era, the second Trump administration. Okay, so here's now we see, this is the percent of people who said they have a great deal or a fair amount of trust in the FDA and the CDC to provide reliable information about vaccines. The pandemic, certainly, these were two agencies that took a big hit, particularly the CDC in terms of public trust. But curiously, we also now see a upswing. If you look at GOP there, Republican identified respondents, that now by April 2025, we start to see an increase in interest or trust in those organizations. And with that, what had happened not long before that, February 13th, Robert F. Kennedy Jr., with a well-established record of anti-vaccine activism and other sorts of scientific sort of contrarianism, was sworn in as Secretary of Health and Human Services. And right about that same time, the President Donald Trump issues the executive order about making America healthy again, and the commission of which RFK Jr. was going to head up. And I have some examples below of some problematic things that were following Robert F. Kennedy into office. I could be here for 3 hours talking to you about his background. We got to keep this short. So the important thing here is that you can think about how this would be the anti-vaccine and related sorts of movements, sort of all this kinds of kind of anti-science, anti-public health kind of movements dream. In the sense of that his appointment really just platformed pseudoscience. It gave it a lot of legitimacy and credibility, albeit under false pretenses. But the fact that it's in power kind of gives it that legitimacy, and gives him legitimacy Uh, and of course, by nature of that very important position and the extent of what Health and Human Services does, he has a bully pulpit. So he has greater ability to reach larger numbers of people far more easily than ever before. His administrative portfolio enables him to appoint people with his sort of worldview, oversee them, really push out his agenda. As well as implement organizational restructuring to his liking, how he wants to organize funds, how he wants to direct agency missions, and even just modifying policymaking procedures too. And with that also becomes the attack on science that we saw right from sort of the get-go since the inauguration. This idea, even executive order of restoring gold standard science, it becomes this term. And you'll hear this a lot in the administration. Gold standard science, you'll see this in press releases and the like, which is really a tarring, a political tarring, and in many sense unsubstantiated or overblown sort of attack on the institution of science and highlighting or overemphasizing particular sorts of problems. Not to say the institution of science is perfect, but definitely overplaying its hand as to what and really casting the scientific community as being very much in disarray and not being worthy of trust of the public and the evidence that it creates. What has occurred also with this is what really, I mean, if you go back and think think of just the weekly news, it's really just been a fire hose of just harmful statements and activities from if you just want to focus on RFK Jr. alone, which is what I'm going to do here. It really highlights just over 6 months. It's just amazing, and it really, in essence, provides a civics lesson. It really highlights the scope of how extensive HHS really is in terms of what it does, and this activity has really highlighted how those duties and even just science and public health overall can be very easily undermined by somebody in that sort of position of power. And what we see here is, so this is the percent of people who say they have a great deal or fair amount of trust in the following agencies and people to provide reliable information about vaccines. You could extend this to some other things, and I'm sure you're going to see very similar sorts of results. But the thing I want to focus your eye to is look at Robert F. Kennedy Jr. and President Donald Trump at the bottom, and to what degree Republican respondents believe them or trust them just as much as their doctor. And you see still Democrats and independents still very much stay fairly to the facts, the science, the expertise, still trust existing institutions that the government has with this, but very different picture here. So definitely two people with a lot of credibility among certain Americans. I'm going to give, to go through everything again, this is going to be 3 hours, and I notice I'm already lagging behind time here. So what I decided to do is just to highlight this. Even for me, it was sort of informative, of kind of a listicle of the noteworthy misinformation-related activities to date that RFK Jr. has done as Health and Human Services Secretary, to give an appreciation of the extent of challenges that we are all going to face as taxpayers, as citizens, as scientists, however we might see our roles. Some of you might be doctors or healthcare providers. The first is the gold standard science hypocrisy that I talked about before. So, for example, his Make America Healthy Again report that he had to produce as a result of that executive order was found to contain errors in it. It would cite non-existent studies to try to make certain sorts of claims. He ends up firing these very well-vetted vaccine experts that are the Advisory Committee on Immunization Practice, a very important board to advise the CDC on what vaccines are safe, which ones are effective, what age groups they should be recommended for. Very difficult group to be part of. You're vetted very closely for conflicts of interest. You have the best of the best that America has in terms of the scientific community working in that area on that. He replaced them then with anti-vax and contrarian clinicians and scientists, including one person who has very close ties with the anti-vaccine activism world. He's unilaterally changed COVID-19 vaccination guidelines without going through that ACIP review, and has also called for a very high quality study that debunked some of his claims. And tried to get that retracted from a major journal. So basically trying to silence good science. He's also relitigating settled science, which is anti-vaxxers are just loving right now. So vaccine-related autism claims are back again. He's going to be pushing a new study that's going to be led by a very underqualified and someone who is legally sanctioned is going to be the researcher running that. Very concerning. He's banned well-studied, well, at least through the ACIP committee that he's now appointed. They banned a very well-studied and safe preservative, thimerosal, for flu vaccines that prevent vials from being contaminated, for example. Completely unnecessary. He has also revived some child vaccine safety, a child vaccine safety panel that was sought by anti-vaccine activists. This was in the news just yesterday. So the goal with that is going to be probably to look over the vaccine schedule, probably nitpick on what they might consider to be safe, could be undermining the schedule that has worked so well for many years. Okay. Third element is, I've got 5 of these, undermining the U.S. public health capacity. Giving mealy mouth or kind of equivocal sorts of promotions of vaccinations amidst the measles outbreak, major measles outbreak in Texas, alongside promoting very non-effective, non-recommended therapies to deal with that. We know vaccines are effective for that. That's really sort of the only preventative treatment. He was offering some other things that that the medical community says no about. He's canceled more recently $500 million of funding that were going to be projects on mRNA vaccines that we could be using for future pandemic threats. And future pandemic threats will be coming. So this is going to undermine biosecurity for the United States. It becomes a national security issue. He's misrepresented then their utility, their safety. We know that that mRNA vaccines are safe. They can be incredibly effective. They're why we had a COVID vaccine within a year, and because they're very easily adaptable and can be quite effective. Not perfect, of course, but nevertheless safe and effective. Fourth, he's endangered public health professionals, denigrating the CDC for a long time, even before he was in position. And now we get this horrible news about the shooting the other day, or the rampant shooting at the CDC. So naturally, people who are working there are very upset, and he's been accused of sort of stoking the ire that his own subordinates now have to face, unfortunately. Fifth, he's hampered U.S. scientific activities, so cuts to NIH staffing, research grant funding priorities. There's many things that Americans, we like to brag that we're the best in the world about, and some of those can be a little overblown, and we overdo it. One thing, though, that I can say that we do very well, and we do probably one of the best in the world, is our research enterprise, and that has been through NIH money, your tax-paying dollars, being distributed to universities, to research centers, hospitals throughout the United States and even the world to do cutting edge science. And that's what's made America a powerhouse over the past several decades. That is incredible. That is significantly crippled as a result of what we've seen just in the past couple months. Also, he's required the FDA, he's put new now guidelines in about how we evaluate vaccines, which are going to hamper development of or approval of already safe and effective vaccines, and delay getting those out. Given time, because I know I'm going on a little too long, and I want to make sure that I get enough time for questions. Just to be sure, how long were you looking? You wanted me to stop at 30 minutes?
So far we don't have any questions, so feel free to go into I have a question written down, but feel free to go into as much detail as you'd like to.
Okay, I'm just getting to the end of kind of the state of the problem, and I'll get into a couple just sort of ideas about how things that we might be able to do.
Right on.
Something practical versus just sky is falling. Okay, thank you. So, maybe I'm stating the obvious here. All these things together, and again, that was just, I put those into 5-6 categories. Again, I could have you here for another 2 hours if we went through everything else and all the people that he's appointed and their decision making and the like, and what their backgrounds have been and why that's concerning. But nevertheless, we see some substantial consequences of all of this and the agency that he runs. The declining trust in science and medicine, public health. We have these funding crises, not just for doing life-saving research on cancer and everything else that might afflict Americans and people throughout the world, but also public health programs. A lot of public health is run through states, not through the federal government, but states rely very heavily on monies being distributed to them for different types of programs. And so with that sort of being cut, that's certainly going to be hampering things at the local level that you'll be seeing within your communities. Also, the problem with this then is, and a lot of talk that I see in my world is about what to do if the government is pulling out of things, how to fill those roles. How exactly can we do that? If ACIP, for example, can't be trusted because the people on there aren't very qualified, how do we advise states that make vaccination decisions, for example, or other sorts of guidelines? How do we get them, how can they get the best information and the best guidelines? Can there be sort of a civic sector sort of ACIP that doesn't operate out of government, or people call it or different sorts of shadow agencies? That sounds a lot more kind of covert, and it's not implied in that way. But how can these things exist in the absence of government doing it, since we've relied on them for years? And this is what government does, and this is what we expect government to do. It's a public good. Because we know that across, what we're going to end up seeing then is, if one state decides not to listen to ACIP and wants to go with its own sort of advisory committee and not listen to maybe the CDC or something like that, we could see a whole patchwork of different sorts of guidelines and policies throughout the United States, and that's not going to be good. And it's just going to be very inefficient and costly too for service provision. Oh, there we go. This whole time. Oh my goodness. Okay, that was strike three, I think. Oh, here we go.
You know what? Our organization, we don't excommunicate people like some other organizations too. So
Okay, good, excellent.
We'll let you go ahead and fail forward. You're good.
Okay, great. So, again, this sounds very much like, oh my God, this could sound increasingly, incredibly overwhelming. What exactly can we do? In the Lancet commission that I've been part of, the Lancet Medical Journal puts together commissions of experts to try to think about different issues. I was on one recently about how to think about ways to increase vaccination uptake and acceptance in the United States. And one of the things that we've written about is this idea of a whole of society approach, that we can't just rely, this was even before the election, we can't just rely on government to be able to address vaccine misinformation, get rates up, overcome exemptions. Also, public health has just been generally underfunded too. So this recognition that really this is something that civil society, community groups are needed. We need the private sector can be useful in this too. And so that we really need this multi-sectoral, multi-level coordination to think about different types of activities. Groups like yourself, for example. And the idea here to build network communities that can reach different audiences at the right time, with the right kind of message, and with the right kind of messengers too. Not some egghead professor, but somebody that people can relate to in a particular kind of community, for example. And really, my argument is that the anti-vaccine movement, for as much as people want to say, oh, those people are kooky or they're crazy or whatever, no, in that sense, look at what they've been able to do. And I think there's huge lessons that have to be looked at on their playbook. Fight fire with fire in this case. We know that they're very well networked. Their messaging, they franchise it, and how they kind of coordinate their activities, how they amplify each other's types of messages. And it's been incredibly effective over the past 20-something years. And I really think that there's lessons that pro-vaccine stakeholders really should be taking lessons from, and that we can be thinking about. Obviously sticking to truth and evidence and things like that, and and doing it ethically, but nevertheless tactics and strategies. One of the things is to rethink public communication. The problem with anti-vaccine actors, and now with influencers and all these other people, there's lots of different ways that they can get their message out. But public health communication can be very siloed. and it can be very uncoordinated among groups. If you go on Blue Sky, there's lots of people like me that try to do different sorts of just health communication, translating different sorts of stuff. And it's very kind of grassroots, and it's very kind of ad hoc. And even Blue Sky itself and the audience in there is very kind of particular. Uh, um, so there's not a whole lot of sort of coordination about different types of messaging to push back against misinformation. Um, also officials often have very limited ability to speak out, particularly federal ones right now, and particularly red blue state kinds of issues too. And so there's opportunities to bring in community influencers and other people with large social media presences to really get at that. The reason being with this is that having more speakers instead of one highly credible messenger, like here's a good example here, I like this, of using Anthony Fauci. I think Anthony Fauci did a great job. Well, again, wasn't perfect on things, but generally, did an incredible job. But we associated him with COVID messaging, and that made him put a target on his back. And so if you discredit the messenger, you discredit the message. Which he got piled on from all these different sorts of groups, anti-vaccine groups, among others. If you have multiple, as this 1 million messengers example to the third panel there kind of shows, it's much harder than to diffuse the message. Take me out, you discredit me with a whole bunch of ad hominem attacks or scare me to shut up, maybe because you harassed me or something like that. Well, there's there's several dozen more people just like me who are doing that. So again, here's where the idea of coordination, and it doesn't mean people with, who are professors and things like that. It's just people who are concerned citizens who might have, who might be, you can bring people up to speed on how to effectively put across a complicated message to the general public, to the uninitiated. Also, improving activity coordination is really important. We need to improve structures that enable us to be better aware of things. What events are going on? So that we can know what are people kind of talking about? What are sort of the new concerns or misinformation that might be circulating around? What bills might be getting pushed right now? How do we find out about that versus, just kind of luck, or what gets covered maybe in the news that we just so happen to see, maybe on social media or on TV? We want to have more proactive and not reactive types of engagement. There's a lot of really good evidence about the idea. We often debunk misinformation. Somebody says something, it's not true, we provide some sort of information that debunks it. There's a lot of good evidence about getting ahead of something, though, and pre-bunking something. The idea of that you're getting the message out first, and in a way that inoculates, very much like a vaccine, immunizes people to a certain degree from negative information or misinformation when it comes down the pipe later on. So how to do that, how to get an infrastructure in place to kind of do that type of messaging, is tricky. And that's, again, where it's going to really, particularly in 2025, going to be relying on different, again, organization coordination, different sectors, and not even just people who are interested in health issues, but even a more broader set of issues, particularly how health has become sort of bundled up with other sorts of political topics as well, other political issues that we run into. Also increasing legislative advocacy and how we might be able to more effectively do that. There's now a lot more kind of pro-vaccine sorts of groups out there, pro-public health kinds of groups, and we're seeing a lot more sort of coordination. I'm even just noticing, like, I get sent a lot of like petitions these days, for example, and a lot of requests to send letters to elected people. And so lots of these kinds of efforts underway to kind of do that kind of stuff. It's very clear that there is a grassroots kind of mobilization that's kind of occurring. Also, just a coordinated threat response. So how can we be capable of countering those messages when we see them? So when Robert F. Kennedy Jr. wants to go on and start bashing mRNA vaccines, for example, and saying untruthful things about them. Do we just wait for that one person to start writing a blog? Who's the virologist that we knows something about that? Or are there better ways that we can think about having groups of people already set to go, and how to think about immediate sorts of responses to debunk that and get kind of on top of it. And also, how can we leverage some of those networks, again, to address and respond even to online threats that people might get, different sorts of pile-ons in social media, or other sorts of harassment tactics that they might be getting, at their workplace or otherwise. And there are some initiatives like the Shots Heard initiative, for example, that's a more online one to try to help out with people who are doing vaccine messaging. And I think that could be a model that could be used for lots of other purposes as well, related to health information, related to other issues as well. The other last one is just funding knowledge generation. So NIH money is now really dried up, but even to study, we're not really allowed to study misinformation anymore from National Science Foundation money. Vaccination research and vaccination attitudes, and getting people, trying to study how to get people to get vaccinated if they're hesitant or they're anti-vaccine. That stuff has been completely sort of slashed from as being prioritized things that NIH will fund, or at least limited. You got to be maybe be a little more creative in how exactly you can do it. And so what are the sources then for studying that? And here's where private foundations really are quite important. But that can be bringing, in this day and age, you can bring them some political attacks too, and get them in the spotlight in ways that they might not want to do that. But needless to say, there needs to be some kind of creative ways to be thinking about, and I don't mean just like academic research, but I mean just even thinking about more kinds of applied ways that we can think about creating programs and evaluating if they work or not. And then the last thing here, sorry, I did have one that's sort of tied to this, is just, again, the idea of social listening. How can we think of more coordinated ways that we know what's going on out there? Who's saying what, where, how different sorts of misinformation might be spreading, the type of misinformation, and then how we can then, that can enable us to respond faster, respond more accurately to things that are out there, and maybe even, again, pre-bunk. There are some funded kinds of groups now, nonprofit kinds of initiatives, but again, very kind of uncoordinated. And so it'd be better to have think about much more of a network with this, and how and getting more involvement with other organizations. Resources for science communicators can be really important here. Definitely we need that. Legislation to prevent doxing of people. Support networks for people who might be trolled or harassed. I have one particular colleague who has been gone through hell and back in terms of being a science communicator and sort of threats. We need to be thinking about ways that we can be keeping that safe, and even just for I would say for John and JQ taxpayer, this even the idea of being more focusing and strengthening our data literacy. For what's out there, so that we can be better users of knowledge that are out there. And it even applies to kids. And there's these really great new, and they're actually, I don't mean this as a nerd, but like there actually are kind of fun games that are out there to try to get you to try to be more aware of stuff that you might come across. Same thing for kids. And even evaluating them, finding that they are really quite effective, at least for the short term. You got to keep, kind of like a vaccine, you got to get your boosters. In terms of being aware and being able to spot stuff when you see them, so that you're just, in that case, a better consumer, an educated consumer of what's out there. So with that, I'm going to end, and I'm really look forward to answering your questions. Thank you for patience. I know it went a little bit or quite a bit over there. And if there's anything else after this too, please feel free. You can catch me on Blue Sky, and also on LinkedIn. Thank you.
Thank you. Are you kidding? Are you kidding me? This is amazing. We just actually, I would say probably about a month ago, had somebody else talking about like vaccines and from a different perspective though. So this kind of fills in some of the gaps from that. And there's a few questions here that I want to get to from the folks who are on this call today. And I love Teresa. Teresa's like public health nerd here.
All right, great, excellent.
Okay, so one question that comes straight from the Q&A was, and I do believe it was answered. Yeah, do you have a theory or data that explains why so many people have become anti-science and anti-vax in the last 6 years? And we have it. Lindsay already pulled the research, probably like from your, so we already have that answer. But if you'd like to elaborate, you're more than welcome to.
Yeah, I mean, there's not really one answer to that. I mean, it really is Yeah, the worst answer journalists hate when they interview professors. It's complicated, right? But it really is multifactorial. I mean, public health did, and the scientific community did as best as it could as with a new threat that came down. What we all witnessed, even online with scientists talking, was science unfolding in real time. And that is what science does, although it was kind of interesting. It was kind of in this open channel with that. And so I think, I mean, one thing I'll focus on, because there's many of them, but I do think what a lot of the public, and I think where maybe some of this lost faith came, not just in terms of how how it got communicated over time, but I think also the fact of that when people think of science, they often think of like settled science things. So things that we call laws, and or gravity, and that I don't know, water can be a liquid or a solid or a gas, like that kind of stuff. And what often a lot of people don't think about is, so when we have a hypothesis and data seems to be supporting that, and then something comes along, better data, and it gets falsified, and we got to now go on to another clue. I think people understand that really well when they're watching like crime serials. It's really the whodunits, but which is, it's very, very much a kind of a similar thing. But for science, I think that does often get looked upon as that we don't know what we're doing and we don't know what we're talking about. And the same thing with medical doctors. We put great faith in. I'll put myself in that too. You go to a doctor, and you kind of expect them to have the answer for everything. And if a doctor says, "I don't know," I mean, that is kind of a little weird or concerning, right? Um, and so in that sense too, I think there was very much, as this was kind of unfolding in real time, we were still trying to figure it out. Um, Along with us having to make a lot of sacrifices, really did foment, lots of sort of distrust of the situation, and that most certainly lingered. And then, of course, you have these bad actors who are, taking pot shots at good scientists who are, as they're publishing in, these short pieces and, op-eds in major newspapers, which are not vetted in the way that the scientific community vets its arguments. They go through an op-ed editor versus you publish in a medical journal. You're engaged in the scientific community. You have to get it peer reviewed, or at least an editor looks at it very closely who has that sort of know-how. And you can't get away with some of the way an op-ed is written is a very different thing than how you would write up your scientific research too. And so it seems very accessible. It seems very convincing. And therefore makes for also easy. It's easy to persuade. I don't want to make it sound like anybody who's not a scientist is a dupe. I mean, a physicist goes on and talks about heavy physics things. I'm going to find it very convincing in an op-ed too.
Right.
And same thing. So somebody who is just not as technically initiated on the subject, the short nature of those kinds of pieces makes it seem much more simple, and the author much more convincing in many respects than often what the complexity of the problem is.
Yeah. So this is I'm going to go ahead. This is from Stephen. And it says, this might be a question or a plea for empathy, but when I consider the pathetic clown RFK Jr., I am genuinely baffled by the questions of why and how this person turned into their current self. Trump is easy and uninteresting, but for me, RFK Jr. is a mystery. In short, how does someone become awash in BS and turn into one of its prophets? I'm at a loss. And I just want to insert before you answer, I put in there the the first part of a 4-part series from a podcast called Behind the Bastards. And he does RFK Jr. 4 parts, an hour at least each episode. And it really, like, the guy he had a really messed up upbringing and experienced incredible trauma. But like, okay, but he's a specific case that is like this weird, American, the whole thing with the Kennedy family and how did you get there and blah blah blah. But I want to like let's let you focus on like how, and I'm not just saying RFK Jr., but a type like RFK Jr. How does somebody become like so awash in this and turn into one of their prophets?
Yeah, I mean, so I'm not a psychologist, so I'll spare you all the psychoanalysis of it, kind of thing. But definitely, here is some. I do think a big element. Well,
Well, and wait, let me elaborate because this is what
Yeah.
Phil follows up and says. To follow up on Stephen's question, what do you feel is the root cause of the increasing distrust of science in the US and the accompanying increasing popularity of pseudoscience? And my answer is going to be capitalism, but I want to hear what you have to say.
Well, okay, yeah, I guess this maybe helps me get away from giving my psychoanalysis of him. Although actually his law background, you definitely see the impact of that. He has an argument to make. He sticks to it. Personally speaking, I really think he sincerely believes in what he does. There's other people in the anti-vaccine world where I do have to wonder if they, just say one thing and they, it's cha-ching and they go to, and then they go to bed at night and do something or do something else, right? But I really do think he kind of believes the stuff that he's into. But again, remember, he was an environmental attorney. He was very big in the environmental movement. So, really that facilitated his entryway into the vaccine world, especially as there was initially, it was maybe a credible hypothesis that maybe there could be something that autism rates were going up. Suddenly, what was going on with this? Here was this. We didn't know that Wakefield was as disreputable as he was and what he was trying to do. And so this seemed credible. And so as an environmental attorney, well, if these were contaminants or toxins, this was his, this would have been his bag, and hence, set us off his career. Also remember, scientific community, the level of evidence kind of needed to claim causality about something is much higher and much stricter than in a court of law. And that's, you might say, well, that's, maybe that's a bad thing or whatever. No, but, in some cases that can be a very good thing, and it's kind of important that we do have that. And so litigating a scientific issue in court is a lot easier to win a case on. And by doing that also can lead one to kind of think that they are onto something, or that they're validated in that kind of way. And certainly, as I said, the anti-vaccine movement moved away from the science stuff, and they moved much more into about the personal rights and freedoms kind of stuff, about coercion. That in that case, those are things that are much easier to litigate in court, and you can win on, and they have successfully done that. When we think about COVID mandates for work, or undermining. Mississippi very much had a vaccination policy very similar to California and New York, a red state, and they did it way before California, New York, Massachusetts, and now all that has been undermined, and brought out and lost in a court case. So we will see exemptions start to go up there as well, and hopefully nothing like what we saw in Texas with measles cases, but who knows? Anyway, so the general. So I think I got maybe a little off on maybe away from the question, though, about thinking about sort of thinking about this. I know what I was going to say. So the politicization of vaccines also makes it much easier for credibility, in the sense of, so I'll give you an example. So like imagine early 2000s, you might have a anti-vaccine kind of story being written by like a science journalist. So somebody who's really specialized in scientific issues, they're going to write on that. You start to see in the aughts, as these things are starting to being taken and litigated in state houses, the different sorts of policies and these medical freedom rights and this kind of libertarian-ish kind of logic. Now, it's battling out in state houses. Who's covering that? Political reporters. And as you're starting to see this becoming more of a partisan issue, it gets bundled up with that. And how do we discuss partisan? You turn on, cable news at nighttime, right? It's always, there's the, one perspective and the other one. Maybe often, you get the screaming blue pundit, and you get the screaming red pundit, and and it's a both sides in kind of issue. And so now you can see things like scientist, we have a scientist on one end, and we have a anti-vax blogger, who just happens to be a parent. Nothing wrong with being a parent, who's concerned about vaccines, but but otherwise, by day they are nothing related to science. I don't know, they sell real estate or whatever. And so that also creates this kind of when you're bundling it up with this kind of and again we see this also with Trumpism too. I mean, it's this kind of the it's not just Trump, but you can see this also on. I am going to play both sides on that one. You see, everybody's got their team. They're and the Bernie Bros and the and the and so when you bundle it up with those other things, it's very easy then to even if there might be some facts behind it, that you're going to warp things in very desirable ways to fit your worldview about stuff. And if somebody that you really trust, like Trump or RFK Jr., as that poll kind of showed, is discrediting certain agencies for being corrupt, or it doesn't, regardless of how true it is, you're more inclined to believe that, which is incredibly dangerous.
Yeah. Here's a plea coming from Jill, and boy, Jill, do we appreciate you. She's a public servant at the school board level, so thanks for joining us today. She asks, how can I help my sister in Idaho, oof, Idaho, tricky, be willing to take the COVID vaccine? She still is unvaccinated, and I find that very concerning.
Yeah. And I mean, in many respects, so much of this is on a case by case kind of basis, because it's really kind of I would say the big thing is of course you got to meet the person kind of where they're at in terms of starting the discussion, finding some sorts of common ground on it, because the finger pointing thing is really only going to lead to reaction and and entrenchment with that. And that becomes a big sort of challenge. The other thing, so that's one element of it. Certainly, I don't know about the details of how trustworthy the relative might be of healthcare providers, who generally the public usually listens to. Although there are some anti-vax doctors and nurses and the like too. But also, where else was I going? Shucks, I had another thought about this too. But yeah, I mean, so in that respect, having that sort of perspective. Oh, I know what it is. Facts and figures often in those cases aren't going to do it. I can show all these sort of statistics on risk and how that looks and what the consequences it might be, or the benefits, or the safety profile. Really, anecdote can be really quite important. And it's used, like I said before, fight fire with fire. With the anti-vaxxers, and have used anecdote. It's very powerful. It resonates. A mom who just had their child vaccinated, and now the child, a couple months later, seems to have signs of autism. Post hoc ergo propter hoc. After this, therefore, because of this, it must be, and it's a mother, and you can, pulls at heartstrings. Or in some cases, really exploiting people, like attributing deaths to COVID stuff, and that's just really sick and disgusting. But you can think of the positive, positive ethical kinds of ways of where anecdote is really important too. And there are people out there too who are kind of like ex-anti-vaxxers, kind of, who now who've kind of brought their stories to the public. And you can find them online, and have different, either they'll put up videos, or they provide even their own sort of input on that, which I find very useful, and I think very important in terms. There's gonna I use the word anti-vax as very shorthand, and it can be very slippery. We shouldn't. I believe that vaccine hesitancy is a spectrum. And you can imagine on one end, there are people who are, as soon as they're up for their vaccine, they're going to go get it. And then there's people, maybe a little less them go, they go ahead and get it, but they're still a little worried about, maybe things that they've heard, or some side effect kind of stuff. And then you got people who might be like picking and choosing, or delaying a little bit, and not getting them all at once or something, for their kids or for themselves. And then, the other opposite end of the you've got the people that are, just a very extreme. It's part of their identity. It's bundled up with other things, the toughest kinds of nut to crack, in a way, to get them, to convince them in many respects. And in some cases, people that probably won't be able to be convinced, whereas the other ones are much more on the fence. But I think it's really important that we don't paint them all with the same brush. And I really do see lots of people along that spectrum as victims too. They've heard misinformation, they've heard these anecdotes and these stories that totally play to emotions. they may just not be aware that even though they got the shot and they weren't sick, or nothing happened to them, well, that could be because the vaccine was working, things like that. And so, I think, really, it's very easy to point fingers and, and use jokes and everything else about them. But I really do think there's lots of people where, compassion is sort of the best medicine.
Yeah, and you know what? I mean, like, so like there's a question here coming from Sandy. What is in it for the anti-science group people? Why do they keep spreading these conspiracy theories and disinformation? And I said, should we even bother making sense of any of these decisions? And basically, I feel like you just answered it. Like, there's a lot of different reasons why people come to these conclusions. And you know what? Some of them might not be wrong, right? Like especially like I
Yeah, and I don't
remember,
want to be an apologist for pharma or the
right,
medical community. I mean, there are lots of things that both have done to sow distrust over time and make people turn to things like, the wellness industry is popping up and people, want to turn to that for a hope on something. There's certain diseases that or ailments that people have that are hard to diagnose and people don't know what to do with them, and or maybe they don't have access to health insurance, and and these things seem simple, but also those present concerning opportunities for people to grift, snake oil sales, and the like, even if it comes in the form of, like Gwyneth Paltrow selling, goop remedies or
right.
I
Or
blank on
all the trad
wild.
wife movement with like the oregano oils and the essential oils and stuff like that. And again, it could be something super valid, like like testing on unsuspecting populations, right? Like the Henrietta
Absolutely.
Lacks story or whatever. Like there's a lot of reasons why.
Tuskegee.
Yes, exactly. Like why certain populations of people could be skeptical of this kind of stuff, but
Absolutely.
again, I mean, there's but I do believe the more mainstream thing that we've been talking about, and your research in particular is more of a well, it's a newer movement, that we're seeing now within the last 10 years. And I think that there's so many, somebody just said, ugh, Gwyneth Paltrow. Yes, I agree. But I mean, like,
Maybe so.
I feel like you and I could probably talk for hours and hours, and I think that everybody that's sitting on this call could hear you talk and me listen for hours and hours. So, but I want to respect everybody's time, and I want to let everybody get into their weekend. So, I typically end these conversations asking you because you're doing some serious research that makes people think a lot about things, and especially thinking about like how maybe not great things are. So what gives you hope in these tough times, Dr. Carpiano?
Oh, that's a good question. I There's things that give me hope, and I think then there's also I'm gonna slightly change the question a little bit while I still formulate the stuff that still that gives me hope about the things. But I do know though I think it's very important. Like I said, even preparing this talk for today, like it it just in terms of the preparate, because just things just kept coming down the pipe. I was like, oh, I'm probably gonna put that into, oh my gosh, and there was that, and it was this, and it really is a fire hose. And I think it's very easy to, I think you got to pace yourself, and and know when to step away, because there is a lot of very concerning sort of news out there, and it can seem hopeless very quickly about it. Things that give me hope are, yeah, kind of some of the nerdy things. Like there are, there's lots of news about, it's kind of science news and kind of discoveries where I'm kind of like, wow, that's really cool. Isn't science great? It kind of got us that, that new thing. Like yesterday, there was like that there's this potential to be discovering a biomarker that could be helpful for, if it does pan out, to help treat and diagnose long COVID, which would be terrific.
Whew,
Like,
yeah.
great. So I take the little small victories on things as well. Some of them might seem a little. I mean, the other one that was a little more bigger, that was bigger than, well, a lot bigger than that. There are at times too, what we might think of as justice might not always be right around the corner. But sometimes, I don't want to say the long arc. I tell my students all this too, because it's a little self-fulfilling prophecy that you don't want to. But the long arc of the universe bends towards justice can be a little you could then say, well, I don't need to do anything. Everything will work out. So I don't want to get too much into that, but definitely things like I noticed when we talk about misinformation, the Infowars, not Infowars. What's his name? Guy from Texas. Yeah, Infowars. The Sandy who
Alex Jones. Yeah, yeah, yeah.
Alex
Yeah, Alex
Jones.
Jones.
So now that progressed, and it looks like his earnings are going to be in receivership, and the Sandy Hook parents, the victims, as he disgustingly preyed on their children and on them, that plays out. So, I think the media. I think the other thing is that you gotta, hope is very important, and you gotta even you can't think about it as that can't put sort of a timeline on it. There are certain things that you got to realize are gonna take a while. Let's see how they play out. Honestly, we're seeing signs that RFK Jr. is kind of getting picked at by his own kind of getting eaten at by his own crowd. So maybe that'll work. Maybe that could work out splendidly. He gets a lot of attention. Our president certainly likes a lot of attention too. I could see maybe where that could, as we serve with Elon Musk. Going down the road where some of this, I hate to say it, where will have to see some negative stuff before we see any sort of good out of it. Look at the measles cases in Texas, for example, or the horrible measles epidemic we're seeing right now in Canada. Before people get spurred into action on stuff. But I mean, it's unfortunate, but in some cases, those can be sometimes the motivators, and that's. So I don't want to say like tragedy gives me hope. I mean, I don't want that to be sort of the takeaway message with it, but I think patience is really sort of important, and not to be, I try not to lose my cynicism, or try not to be so cynical about things, and
That's
try to stay.
it. Like I feel like a kid on a jungle gym, who's on like the monkey bars, and I'm going from one positive interaction to another, and everything negative is down below. It's like lava, right? So like I just, and every once in a while you don't your upper body strength isn't strong enough to do the jungle gym thing. So you might have to fall into lava for a second, but you can always like pick yourself back up. Like we can do this. It
And
is.
I'd say too, the other thing is stay focused on something that you if you were to look at my blue sky thread, you probably lately 80% of it is probably RFK Jr. Sort of stuff. I mean, yes, there's a lot of activities under HHS that he handles, but my also thinking with it is there's so many other things that are going on. And as a policy professor, that would be of interest to me or concern of me, or that I would know something a little bit about. But like, it's just too much. It's overwhelming. You got to stay focused on that's for somebody else.
Yes.
Yeah.
Oh my gosh.
So
Okay.
stick to the issues that so I would say, to everybody here, stick to that pet issue that's, you're being the bonnet.
That is the lesson right there, everybody. Thank you so much, Dr. Carpiano. Take that focus
Thank
of
you for
all
having me.
yeah, no, but like what you said though, the focus of all the things, let's narrow that focus. It may be RFK Jr. for some, it may be the Supreme Court for others, it may be what's going
Local
on.
school boards.
Exactly. Thank
Yeah.
you for saying that too, because that is what we focus on quite a bit. So
Yeah.
narrow your focus, y'all. That is the hope that Dr. Carpiano has given us today. Thank you so much, Dr. Carpiano. This was exactly what I needed to start my weekend. Thank you.
Oh, great. Well, thank you so much for having me. It's been great. You've been a great audience too. Great questions.
Fantastic. All right, everybody. Have a great weekend, and we'll see you next week. Take care. Bye-bye.